Hello and welcome. I'm Dr. Gregory Kent, a board-certified ophthalmologist and LASIK surgeon. Thank you for visiting us and learning more about the LASIK procedure. Thanks for educating yourself about our practice and considering me as your surgeon. I know what an important decision LASIK is, and I appreciate the trust that you've placed in me. During your consultation, we'll perform a number of diagnostic tests. These are designed to inform me as to whether you are an ideal LASIK candidate, and how confident that we can be to give you crisp, glasses-free vision after we're done. Our testing includes autorefraction, which provides an accurate estimate of your prescription. It also tells me how steep or flat your eye is, which is an indication of whether you're nearsighted or farsighted. It can tell me how much astigmatism that you have. Astigmatism refers to the shape of your eye, whether it's perfectly round like a basketball or a bit out of round, more like a football. With LASIK, we have the capability of correcting even high degrees of astigmatism. And this autorefraction helps me understand where the astigmatism exists on your cornea. In addition, we perform corneal topography testing, which tells me about the thickness of the front and back surfaces of your cornea, so that we can be confident that you have sufficient corneal thickness to safely proceed with LASIK. During the LASIK procedure, I make a small protective flap on the surface of your cornea, which looks like a contact lens. It's critical that you'll have enough corneal tissue to safely proceed with LASIK. If your cornea might be a bit too thin, we would likely recommend a different procedure called PRK. It's the same usually as LASIK, but with a different first step. We know that the topography is that test which guides me into determining whether LASIK or PRK might be the best procedure for you. In addition, the Galilei topographer will show me any unusual ridges or valleys on the surface of your cornea, and also your pupil size. I want to make sure that when we use the excimer to sculpt your new prescription onto your eye, we correct your vision at all pupil sizes from dim light to bright sunlight, so that we can minimize any night vision issues that you might get from LASIK, like glare or halos. These conditions were common in the early days of LASIK, but the technology now is advanced so that we significantly reduce the likelihood that there'll be an issue for you. I'll do your procedure right here in our very own LASIK suite. I use the Wavelight EX500 excimer laser to sculpt your prescription onto your eye. This laser is what's going to help you live without glasses or contact lenses into the future. In addition, we have two choices for step one of the LASIK procedure: either a handheld instrument or a laser, which makes the protective LASIK flap. Both have identical surgical outcomes. However, some people prefer the all-laser solution, and some feel more comfortable with the less expensive traditional method. Either way, your surgical outcome should be identical, so I'll try and recommend which technique best suits your eye anatomy. Think about any questions that you might have, and I'll be in a few minutes to talk with you and answer any of those.